right. Well, good afternoon, everyone. Thank you for joining us today. My name is Jodie Brockman. I am a coordinator here at NKC Health in the Community Health and Wellness Department. And I'm so happy that Jason Calder was willing to share his expertise with us today on a great topic that I'm really happy to be able to learn more about. Welcome, Jason. He is a seasoned healthcare professional with over 21 years of experience here at NKC Health. He holds a master's degree in physical therapy from the University of Missouri Columbia and is recognized as a certified spinal manual therapist and certified therapeutic pain specialist. Sounds like we might want to hit Jason up in the future for some more presentations on pain. For more than 15 years, Jason has played a key role in the Living with Diabetes program here at NKC Health. His commitment to diabetes education extends beyond the clinic. He has conducted community classes, served as a guest lecturer, and instructed healthcare professionals on strategies to improve outcomes for individuals living with diabetes. In addition to his diabetes-focused work, Jason brings deep expertise in treating complex and chronic pain conditions. Over the past 8 years, he has collaborated in clinical research initiatives and advanced patient care through innovative approaches to pain management. So thanks again, everyone, for joining us today as Jason helps us understand how physical activity supports blood sugar management and overall health. Take
Very
it
good.
away.
Well,
Yeah.
yeah, thank you guys for tuning in here to learn a little bit more about how exercise affects diabetes. We certainly are going to get into this here. Can you guys see my slides okay here?
Yeah.
Very good. Okay. Well, first of all, we want to talk about what do we consider exercise or activity. So a lot of times when we're talking about uh, diabetes, especially if you've been diagnosed newly with a disease process like this, it can be really overwhelming. There's a lot of things doctors will tell you about this, and one of the things that they'll talk about often is diet and exercise as a part of a way to manage your blood sugars, and they are very important. But even the word exercise can be a very kind of off-putting, I guess you'd say, especially if you haven't been doing it a lot. So, we're really talking about activity. And I would say, how many people want to exercise more? Probably not a lot of you would raise your hands. But if I said, how many of you would like to maybe be more active or continue to be active? That would be a very positive thing. I think a lot of us could be like, yeah, we would definitely want to be active and stay active, or even maybe become more active. And so that's really what we're talking about, is just exercise as a way of activity. There are some specific types of exercise that are shown in the research to really help with blood sugar. So we're going to talk about activity and exercise in that way. And we'll kind of lay this out here for you so you can hopefully leave this talk feeling encouraged and empowered to go start being active and exercise. So the health benefits of regular activity, of course, we've heard about activity and exercise helping us out. So the recommendation in general is about 150 minutes per week. So right here at the beginning, you can grab your pen and paper and write this down as a goal to get 150 minutes a week of moderate intensity exercise. That's what has been shown to help with blood sugars the most. So if you're wondering if you're doing enough, you can easily add up the minutes to do this. When we get regular exercise, it helps build and maintain healthy bones, muscles, and joints. It helps us to control our weight, which, by the way, a little info here is that diabetes isn't always because of obesity. Like, you can be near an ideal body weight and still have diabetes. But of course, we call it an ideal body weight because it is just that. It's ideal, and so we want to be close to that ideal body weight if we can. So it helps control weight. It helps also decrease stress, tension, and anxiety. I don't know about you, But if I'm really stressed, man, it just helps to do something active, go for a walk to blow off some steam, or perhaps chop wood or do something like that where you're like doing something physical and it really does help. If anybody wants to chop wood, you can come on over. As long as you stack it neatly, you can come over and I can help you with that. So, so overall, when you do activity, it makes us feel good. It releases endorphins and enkephalins. These are our body's own natural feel good hormones and chemicals that help us to feel better and can help calm us down. And as a result, we will see stress levels decrease. We feel more positive, and again, blood sugars are improved with that. That, of course, is the direction that we want to go. There we go. All right, so here's a little slide, and this is maybe just a little bit in talking about how exercise affects different parts of our body. First of all, when we exercise and we reduce we talked about weight loss. If we reduce adipose cells, and those are fat cells, the cells that are responsible, and it can be inside our muscle or layered in our abdomen as a whole layer, not within the muscle, but we can actually, the more fat deposits we have, we actually will have decreased uptake of glucose because adipose cells don't uptake that. But if we change muscle fibers and get them more lean, and that means exercising them and strengthening them, what we have more muscle fibers, and we have more muscle fibers and more muscle cells, those cells are able to take in the glucose more efficiently. So think about it this way. If we had let's say we have a old steam train, one of those trains they had to shovel the coal in there to kind of stoke up the fire to get the steam going. Well, if that train didn't have to go very fast, there's really not a reason for the guy shoveling this coal. There's probably a name for him, but anyway, the shoveler guy to shovel very quickly into the fire if the train doesn't have to go very far or very fast. Well, that's kind of like the coal is like glucose. It is the energy for our cells. And if our body the train is not required to do much, if we're not lifting much, if we're not walking far, if we're not doing much activity, really the glucose is going to stay piling up behind this stove unused. But if we can demand more of our system, demand more of our muscles, well, then our muscle cells start to use more glucose. The guy shoveling the coal, per se, shovels that in quicker. And so the muscle cells actually use the glucose. It doesn't pile up in our bloodstream, which is where it causes all those problems. And so we just want to be aware of it, that our muscles are the biggest thing that we can use to utilize the glucose that's in our bloodstream. So if you want to lower blood glucose, there are medications for that. There are things that we can do to help the liver from producing as much and whatnot. But the best thing that we can do is activate our muscles. It is actually the quickest thing we can do, because if you start to work your muscles, immediately your blood sugar starts to go down immediately. So it's rare in medicine where we can say, hey, this is going to help you right away. This is going to help you right away. So I really do encourage some exercise and activity.
Hey, Jason, I hate to interrupt, but
yeah,
we're not seeing the slides move
at all.
Uh-uh.
Gotcha. Thank you for interrupting.
We're on the second slide still.
Yeah. I don't know why that would be.
Yeah.
I might reshare.
Yeah.
Yeah, we'll try that.
Technology, I tell you.
Yeah, that's right. What would we do without it?
I'd be happy.
Yeah, right. Okay, how are we doing here? It's saying it is paused. My screen sharing is paused. Do I have the option to unpause it?
You want me, why don't you get out? I'll try to share them and I'll just kind of drive the slideshow. You want me to try to do that?
Sure.
Okay, let's see if I can do it.
It says I'm screen sharing now. It says it's okay. Do you see the slides moving?
Let me go back.
Sorry.
No, you're fine. Okay. Yes. Yes. Oh, yes.
You are seeing it really. Okay, good, good. All
Thanks.
right, very good. So again, this is the sorry guys about that, but this is the image I'm talking about, and it just is showing again kind of what I was iterating about how there are lots of things that exercise does, and one of the good things, one of the best things that it does is down here at the bottom. It talks. So you can see the muscle fibers, and the muscle fibers are definitely the things that utilize the glucose the most. So that's what we want to get active. So when we exercise really all movement is good movement. So I wish it made it sound more complicated because I'd sound smarter probably. But really, it's any sort of thing. Anytime you're moving, especially if you feel like you're working moderately hard to hard at an activity, then you know you're doing something. And of course, some movement is better than no movement. So even if you're not at that moderate level, if you're just doing some light work, it would be better than sitting and doing nothing. So endurance type of work, of course, this works your heart and lungs, the circulatory system. Strength work and resistance. So that's going to be like lifting weights or doing something like getting up and down from a chair several times. Those things are kind of resistance type work where we're really kind of activating the muscles. Balance work, and that's things like you might take a balance class at the Y or something like that, or practice standing on one foot or kind of with a narrow stance. Balance work is definitely good. It uses all sorts of muscles, by the way, when you're working on your balance. And so I might give somebody for an ankle exercise 15 different exercises, but if they stand on one foot, they're actually going to be using as many or more muscles with just balance exercise. Flexibility and stretching, that's really good. And so some people take like a chair yoga class or something like that. I think this yoga class on the beach that's pictured on the slides is probably the best place to do yoga. That looks great, doesn't it? Uh, so anaerobic exercise, and that's kind of exercise that requires like a big workload where you would be out of breath. And so sometimes you think of that like swimming quickly or sprinting or that sort of thing. Strength training falls into that category, and then aerobic exercise is like cardio. So you definitely have to wear spandex to do that cardiovascular exercise. Um, so let's talk about specifically diabetes and exercise. Excuse me. So our diabetes and exercise, when we exercise regularly, we actually burn more calories even when we're resting. And if you think about this, if you have more muscle fibers, so if you build a bicep muscle and that bicep muscle gets a little bigger, or there's less adipose tissue in that bicep and it's more lean muscle, so more muscle fibers. If there are more muscle fibers, they require energy just to stay alive, even if they're not active. So if you build more muscle and lean muscle, you actually end up having a higher metabolic rate or resting metabolism, which is great. So you can even burn more calories when you're resting, even when you're not in exercise sessions. So it sounds too good to be true. But really, you can, if you exercise regularly, you'll actually get benefits in between the workouts as well, which is great. Because again, it's using blood sugar just to keep cells alive. So by making more cells, having stronger muscles, bigger muscles, you actually can see calories burned in between those sessions. Lower blood pressure and cholesterol levels. Of course, when you do have diabetes, that doesn't necessarily mean you will have cardiac issues necessarily, but it does put you in a higher risk category. So we want to be just careful to manage risks where we can. And so doing regular exercise is going to lower your blood pressure and also cholesterol levels. So that's really good. It lowers cardiovascular risk. Improve cardiovascular function, of course, you're going to have a better cardiac output and function if you are doing regular physical activity. So that's excellent, right? So you're going to feel like you can work more and do more, and then it helps decrease complications like things like neuropathy and retinopathy, things that complications that can go along with diabetes. It lessens the risk of that, which is excellent. And then also, again, like I mentioned, it improves insulin sensitivity. So basically, your cells, your muscle cells will be more sensitive um, to insulin and using the glucose that's available. So when muscle cells are insensitive to insulin, that's when, um, unfortunately, blood glucose levels rise, and our pancreas will need to put out more insulin, try to produce more insulin. And the thought is that our beta cells can wear out with that repeated cycle of being insensitive to insulin. So by making our cells more sensitive to insulin, which is going to be the key to bringing in the glucose, we can actually reduce insulin requirements. So again, really exciting stuff. If we exercise, our muscles will use more glucose and be more sensitive to doing that. And I think if anybody has any questions or anything, you can send those in, and we can kind of bring those up during the talk. There'll be a time for questions afterwards as I kind of move through this here. Hopefully, I'll answer all your questions though ahead of time. So aerobic exercise or cardio, we're talking about that. And I was kidding. You don't have to wear spandex to do aerobic exercise. I've been told that spandex does have a limit, and so not all of us, like me, should wear maybe spandex, so that's fine. So wear something that's comfortable, but we want to, cardio just speeds up your heart rate and your breathing, and you might sweat and breathe hard and stuff, and that's exactly actually what we're going for. So things like walking, jogging, biking, or swimming, those are all good options, things like that, just to get your heart rate up. So a good goal is to gradually increase the intensity and length of exercise sessions as you become more fit. So you wouldn't necessarily start with 60 minutes of activity, but the AMA, the American Medical Association, is actually, they recommend for all healthy people that we get 60 minutes a day of regular physical activity. And some of you have done the math and realized that's an hour. And that is a long time to exercise, but that can be broken up in little chunks. So again, like a 20 to 30-minute chunk would be good, or even, kind of walking up the stairs at lunch would get the heart rate up. I think Jodie's over there at the NKC Health campus, right? We have a lot of stairs. So if she took the stairs just up to the top and down again, she would be getting a good cardiovascular workout, which would be very good. So the 50 to 80% intensity that we're looking for is kind of our based on our heart rate. And there are charts and stuff. So if you look at your target heart rate, you can look up charts about that. But basically, you want to, again, be feeling like you're working moderately hard to hard. So if Jodie's on those stairs and she's walking briskly up the stairs, and maybe I'm able to keep up with her, and I say, hey, Jodie, how hard do you feel like you're working out? If she said, I'm working out very lightly, or not working out hard at all, then we would ask her to go faster to get into that workout range to be considered cardiovascular exercise. Now that would line up with that 50 to 80% intensity of her max heart rate. So we want to get her into that moderately hard. Now, if she were going up the stairs and she were to turn to me and say, Jason, how hard do you feel like you're exercising? If I couldn't get a word out, I'm like, oh, this is so extremely hard. Well, then that's too difficult, right? And we would need to slow down the activity just a little bit. Either if I'm on the stairs, I could take them slower. I could stop and take a break for a moment so that my heart rate comes down, and my corresponding feeling of how hard I'm working out gets back down to that hard, moderately hard to hard range, rather than extremely hard or severe. So, of course, we do recommend that you talk to your doctor about this, especially if you have cardiac issues. I would imagine most of your doctors have said you should exercise more. And if that's the case, then that's the green light to go ahead with that. But any sort of heart issues, you definitely need to be aware of that. So here's a slide that just talks about some moderate intensity or vigorous activities, moderate intensity exercise, or again, with like the talk test. If you're able to talk during that, even if you're a lot out of breath, it says you can talk but not sing. So I've got a sixth grader girl, and she loves to sing right now. It's all about K-pop Demon Hunter songs. And I would love to find a way to get her to not sing. No, I'm just kidding. But when she's exercising, if she's still able to sing, then it's probably not hard enough to be considered moderate. So we would want to maybe increase it again, just to get to that point where we can still talk. We could, even if we're a little out of breath, we could still have a conversation. But again, not enough to sing. And more vigorous intensity exercises, then we have to pause for breath. And so vigorous intensity is okay to work out in. That's that breathing a little hard, but still able to get a few words out at a time. Hope that makes sense to everybody. We would modulate activity. If you had a treadmill, you could increase the incline or the speed. If you're on a resistance bike, you could turn up the resistance on the bike so that it was making you pedal harder. And those type of things would be ways that we could increase or decrease the workload to increase or decrease our cardiovascular output. So cardio is a great thing to do. Again, that's going to fit into that 150 minutes a week that we were talking about. If you'll notice, the AMA's recommendation of 60 minutes per day is actually a lot more than the Diabetes Association's recommendation, or what the studies have shown, for 150 minutes a week, which is great. So we're going to go for the lower. We're going to shoot for the 150 minutes a week to get the benefit that we need for the blood glucose if you want to start somewhere. All right. So moving on to the anaerobic exercise, and that's the resistance type of exercise. That's exercise that the focus isn't to get our heart rate up, but the focus is really to work the muscles. And so we're going to look to do things that work our muscles. You could do this in like a circuit training, by the way. So you could move briskly through strength stations, or if you're in a gym and you've got all that equipment and you're kind of moving quickly through that and maybe throwing in some cardio in between, you can actually do both at the same time. But strictly speaking, strength training is there to build muscle, not work our heart rate. And so the intensity that it mentions on here has more to do with our 1 rep max. Now, that may not be something that you ever want to mess with. Basically, if you could lift a weight one time but can't lift it another time, that's our 1 rep max. And then you would back off into a percentage of 40 to 60%. To make this simple, if you can lift a weight about 8 times, that's probably the right range to start in. If you could only lift it 1 or 2 times, it's way too heavy. You got to go lighter. If you feel like you could lift a little pink weight like 200 times, that's way too light. You need to increase that. So we want to be in that 8 to 12 repetition range, and then do 2 to 3 sets. We should feel like if our goal is to build muscle, and that's really what our goal is here with this strength training. If our goal is to build muscle, we have to work to the point of fatigue. We have to feel like, man, I can hardly lift this one more time. Okay, so if we get to 12 reps, 11 is difficult. Maybe I don't get to 12. I only got to 11. That's good. That's actually what we want. And we want to have that resistance appropriate and work hard enough that we feel like, man, that was difficult. And that may result in some soreness, not pain during the activity, but soreness or that burn of like working the muscle. That is not a negative reaction. That's actually what typically happens when we exercise. So, starting gradually and working our way up into that, but always trying to push the limit on that. If you're doing the same weight today that you did a month or 2 ago, then you're probably not increasing. You're probably maintaining where you have, which is fine if you feel good about your strength and your muscle mass and all that stuff. But if you're looking to build strength and build muscle mass, you need to be trying to increase our reps or resistance pretty much every time. So here's a slide that has some examples of just things we could do in our chair. So you could do something like an overhead reach, and if you want to do this along, you certainly could. But if we're sitting in a chair and we're reaching up overhead and maybe alternating our arms, just reaching overhead, and we did that kind of briskly, well, we could have a cardiovascular component to that. That could get our heart rate up a little bit if we did this for a minute. In fact, if you did it with me, looks kind of silly, but we could raise our arms and lower our arms, and you think about, okay, if I did this for a whole minute, what would that feel like? Well, that would feel like cardiovascular exercise for most of us. We might feel a burn in the muscles a little bit, certainly, but then if you stop and pay attention to your heart, you'll notice your heart rate's going up and your breathing's getting a little bit harder. That's great. You didn't join a gym. You didn't put on spandex. All you did was move your arms a little bit in your chair and you started to get some cardiovascular exercise. How cool is that we can do that just sitting in our chair at home? So we can do things to get cardio, or we could grab some weights. You could push against some resistance, or you could you could hold on to some like those elastic bands, or buy some dumbbells, or find things around the house, a cat and a bag of rice or something like that to push overhead. And you could actually push some weight overhead. And if you worked on doing 8 to 12 repetitions, then that overhead reach becomes a resistance exercise. You see, we can do the same movement. Depending on how we do it, it might become cardiovascular exercise, cardio, getting our heart rate up, or it might be strength training, depending on how much resistance we have there. So other examples on there certainly of like bicep curls and tricep extensions, pushing the weight just from our elbow. Oh, my arm disappeared there. Or things like marching in our chair. Those can certainly be things we do in the chair. Well, standing exercises like raising on our toes. Now, this is where we start to use our body weight. And man, when we start to use our body weight, how great is it that we have our body weight everywhere we go? We don't have to have any equipment, just ourselves. And so just raising, pushing up on your tippy toes, or getting up and down from a chair, or doing small squats. If it hurts to get all the way up from a chair, maybe doing a small squat, holding onto your kitchen sink, marching, or kicking your legs to the side, or high marching in place, or across the living room. These are all things that you can do to either, again, look at that if that as resistance exercise, or if you're doing it for a few minutes and getting your heart rate up, it would be considered cardio. By the way, there are lots of exercise videos online. So if you wanted to look up, a 20-minute living room exercise standing, Google it, look on YouTube or something like that, and you're going to find all sorts of options for you. Of course, it shouldn't be painful when you're exercising. You shouldn't hurt in your joints or in your body. And if you're like, oh, that's sharp, or that feels like it's going to cause a problem, and maybe you need to talk to your doctor and maybe get to see a shameless plug for physical therapy, right? Get in and see a physical therapist to figure out how you can exercise safely. But feeling it burn, feeling it working or stretching, those things are probably okay. And again, starting off moderately and working our way up. Now, warm up and a cool down, those are just kind of gradually, especially if we're doing cardiovascular exercise. That's just kind of doing a little bit of light something so that we can kind of work our way up into our target range. So that's just taking a few minutes of kind of a slower pace and kind of loosening up a little bit. If we're going to go for a walk, maybe I do a few stretches or something like that. That's a good time to do that. And then a cool down would be like if I just worked out and maybe I was doing aerobic exercise, or maybe I was doing weightlifting. And if I'm doing that, I might take a few minutes afterwards to go for a slow walk or something to kind of allow my body to move lightly and flush some of the lactic acid out. And so I have a little less soreness and stuff. And stretching at the end is actually probably the better time to when our muscles are warm. But you can certainly do that at the beginning too. So here we are to talk about blood glucose and when to exercise. So generally speaking, the best time to exercise is about 1 to 3 hours after a meal. So we've digested some of our food, we've got the glucose in our system, and it's ready to be used. When you're, if you're, when you eat your food and you digest it, your blood sugar is actually going up a pretty steady climb, and it's going to hit a peak at the glucose level. When you hit your glucose peak, especially if your glucose is really high, your blood glucose is really high, that's where damage is considered to be occurring. So we want to try to lessen that tip of that peak. And so if we do exercise kind of as our blood glucose is going up after a meal, especially if we've eaten something maybe we shouldn't have, if we went to our grandson's birthday and we ate that birthday cake because he needed to know we loved him, and so we celebrate with eating the cake, which is maybe not the thing we should do. But when that glucose is spiking, what we should do is exercise and do activity to diminish that spike. So it's almost like we're shoveling the coal out, and it's lowering that spike, so then our glucose doesn't get as high and causes as much damage. Especially if we're on medications to decrease our blood glucose, we want to be careful to not skip a meal or exercise before we've eaten. So some people love to get up and exercise in the morning. That's whatever time you'll do it is the best time to exercise. But if that's before breakfast and you've gone all night without eating, then that can really mean your blood sugar is already starting off pretty low. And when you exercise, it's going to further decrease that. So you do want to be careful of not getting low blood sugar, right? If you get exercise late in the evening, it's kind of the same thing. If you go to sleep, you may not recognize some of the effects of that, or some of the signs of what we call hypoglycemia. Hypoglycemia being low blood sugar. We'll talk about that a little bit more in a second. The way I remember it, by the way, is if you feed a kid a lot of candy, do they get what did we call them? Hyper. Yeah, they get really hyper when they have a lot of sugar. So hyperglycemia means high blood sugar, and hypo is the low part of that. So of course, drinking plenty of fluids before is always a good idea. Wearing proper shoes for your sport. So they have walking shoes that are actually made for walking, and running shoes made for running, and cross trainers more for lateral movements, or tennis shoes, those type of things. Generally, like loafers or things that are sliding around, they've got these Skechers slip-ins that are nice. Those have kind of elastic to hold your foot. But sometimes if we're slipping into shoes like loafers or Crocs or something like that, they're actually going to slide around when we're walking or moving, and it can produce blisters in our on our feet. And of course, if we don't have great feeling in our feet, that could mean that we don't even know it's happening. And that can mean that we end up with wounds that are slow to heal, and all sorts of problems. We've heard of problems with diabetes and that. So we want to be careful that our exercise doesn't cause more problems. So good fitting shoes for the activity with socks on is usually the best way to go. And of course, talking to a podiatrist if you've got weird foot stuff that you need looked at, or for regular nail cutting and taking care of things like corns and calluses and that sort of thing are the best option. So a couple other things to remember. You want to let people know when you're exercising, just for safety, let people know that you have diabetes. And I don't mean like run through the streets like I got diabetes, not like that. Not let everybody know. But if you're working out with a trainer, like let them know. If you're working out with a physical therapist, let them know. If you have a workout buddy and you're playing pickleball or something like that, let them know that you have diabetes. And what that means is that if your blood sugar goes low, you've got a way, they know what to do in that situation. So making sure you have emergency food with you can be very helpful. So they have glucose tabs that you can actually have, and you can put them in your gym bag or something like that. But having an orange juice or apple juice or something is really good. Some people have like a hard candy or something like that. So those can all be helpful to raise your blood sugar quickly if you need to. So that would be an emergency type food or glucose type supply. Um, and also just being aware of when your insulin is peaking. So when your insulin is at its highest, so like if you've taken an insulin dosage, your insulin, as your insulin is going up in your bloodstream, it is bringing down your blood glucose. And so if you know that 1 hour after I take my insulin is the peak time, that's probably not the time I also want to be at my peak exercise, because that's going to be kind of a double down, bringing our blood glucose down. So just being aware of what our peak times are on our insulin, and maybe not being out on the trail running or midway through a pickleball game, because you could really feel that blood glucose dropping. And then being consistent, that's really important. So if the recommendation is 150 minutes a week of moderate intensity exercise, well, then you don't want to cram it. You don't want to go all week and then on Saturday I got to get 150 minutes a week, right now in. That's a bad idea. You want to spread that out. You certainly wouldn't take medications that way. And so you wouldn't want to dose your exercise that way either. We're going to spread that out through the week, the 150 minutes out through the week, so that that you get that benefit all week long. I will tell you, as our muscle cells are bringing glucose in more effectively, they do that because of these you can think of them as doors. They create these doors for glucose to be brought in, or system. It's a protein chain that the muscle makes and puts in the cell itself. But those protein chains only last about 2 days. So they're always being remade. So the thing is, there, you don't want to go more than 2 days without exercising. If you're going more than 2 days without exercising, then those doors, they start to break down, and the cells become less sensitive to that glucose or that insulin again. So just be aware of that. Try to not take 2 days off in a row. Because we want to keep the ball rolling on that. So you could do cardio, you could do your strength training, and those are going to be very helpful as you be consistent with that. So again, we talked about this, about checking with your doctor about what kind of exercise is right, and if you have some serious issues like retinopathy or neuropathy or some of these other opathies, we want to just be aware that there may be some extra precautions that go along with that. If there's severe heart disease, of course, that's going to be very limited. You need to be closely monitored by a doctor. and not in some general exercise class, it's going to be pretty limited. But for these other things, you can take some precautions and still be pretty active. So just be aware of that. And then it says monitor for hypoglycemia. Let's talk about hypoglycemia. That would be where your blood glucose is less than 70. So if you took a resting glucose, um, and your resting glucose, or your fasting, excuse me, fasting glucose was less than 70, that would mean that your blood sugar is really pretty too low, and you should not exercise in that case. Symptoms could be shakiness or headache or anxiety. Well, and I would say if you've eaten and your glucose is still really low, that's a big problem. So we would want to make sure that we're not exercising because that's going to drive our glucose further down. We should generally take something, and there's some of these treatments down here. Juice or soda or something like that that has sugar in it, and then wait 15 minutes, check it again. Hopefully our glucose comes back up into the range. So typically this is you haven't eaten or you've taken your medication and your blood glucose is dropping. You certainly don't want to exercise during that. If you're having confusion, or you can't get your blood glucose to come up, that's a reason to call 911. So just keep that in mind. Hyperglycemia, by the way, high blood sugar. If you're fasting, that means if you haven't eaten and your blood glucose is really high, that means that your body's not breaking down or not using the glucose it has. So that if your blood sugar is really, really high, but you haven't eaten in over 8 hours, we would expect the blood glucose to be low. That's unusual, and you would not want to exercise during that. But if you, like I said, had eaten the piece of cake and your blood glucose is high, above 120 or 30 or 200, that would be a perfect time to exercise to bring that spike down like we talked about. So generally, we don't worry as much about the high blood glucose unless you've been fasting. So if you've been fasting, you haven't eaten for over 8 hours, and your blood glucose is very high, 120 or higher, and you've been fasting, then don't exercise during that either. So those are two situations. If your blood glucose is less than 70, or fasting, it's well above 120. We would want to check with our doctor about that or healthcare professional. Okay. So here's the wind up, guys. We're going to put a bow on this whole thing. How do we do this? The best way to do it is consult with a physician. Make a plan, join a gym. Sometimes you have to hire a personal trainer. Works differently for everybody. I'm motivated by being around people and usually having a good goal. So like if I have an event, a hike or a run I've signed up for or something like that, then that's going to be the thing that motivates me to move forward. So maybe you get a friend and you're like, hey, I'm supposed to exercise more. I listened to this brilliant physical therapist from NKC Health, and he said I should exercise more. Fine, you can say that all you want. That's good. And then get a friend to join you because they probably need to be exercising more too. Start slow and work up. So they have all sorts of things like I said, you could look on YouTube for free resources. There are online resources subscription things that you can pay for that give you all sorts of exercises and different things to do. You could join a gym like the Y or the community center that has classes. NKC Health, they have community classes as well. You can check on the website about that. They've got community classes in the water or on land. Those are great options, especially if you're having joint pain, to get in the water and do some exercise. So don't freak out about soreness. That's normal. I mean, if you're really hurting, you're like, oh yeah, it hurts. I can hardly walk. That's awesome. No, that's not awesome. That means that you've done too much or you're kicking up inflammation or irritation. That's not what we want. Get to a PT if you need to. And remember, we're shooting for, here's our goal, 150 minutes a week of moderate intensity exercise. So generally speaking, 3 days a week of aerobic cardio exercise, 3 days a week of resistance or strength training exercise. You could do them all in the same day. If you're going to the gym 3 times in a week and spread that out, that's most days of the week. That would be reasonable. Or if you wanted to go to the gym or do the exercise, so every day you have some exercise, maybe 6 days a week, 5 or 6 days a week, that would actually be really, really good because then you're consistently doing some sort of movement or activity. And I would say find things that you love and enjoy. I mean, again, if pickleball is the thing, that's great. I mean, you could go walking right? I don't know. They don't think about malls anymore. Do you remember the mall walkers when they would come through and you're like, oh my gosh, get out of their way. They're mall walkers. Like you can walk in the mall or you could walk in the neighborhood and not work very hard at that, especially if you have a little yappy dog like this, maybe. But if you've got a husky that's pulling you along, you're going quick, well, that's going to be a really good workout. So depending on the speed, but find something that you enjoy, but then think about like, how could I make this workout harder? How could I get in that moderate intensity of exercise so I truly get the good benefit? And then here's a little quote. We love it. It says, if you don't like something, change it. And if you can't change it, change the way you think about it. Right. And that's the way it is with exercise. If you're like, well, I can't exercise, then maybe we need to think about our activity as exercise and how could we, again, modify that activity to make it a little more consistent so that we get regular benefit or maybe harder if we need to. So that's really it. That's our talk in a nutshell. We give this talk in our Living with Diabetes class, which happens regularly at NKC Health. We have diabetes educators that teach this portion of it. I taught it for 15 years or something like that, and they're doing great work there too now. And so I encourage you guys, you do need to, if you haven't taken a diabetes type class, do it. The class goes into different topics where they talk about of course, diet. We have a dietitian that talks to us about that. We talk about medications. We talk about monitoring. We talk about all the cool new stuff that's happening out there with monitors and continuous monitoring and really getting tight control of this. This absolutely, diabetes is one of those things that you can live with and live a long and happy life and manage your diabetes. And exercise is a huge component in that. But this class really talks you all the way through it with our wonderful diabetes educators that do a great job. They'll just hold your hand and help you along, especially if you've been newly diagnosed. You do need a script for that. So if you newly diagnosed and you haven't been through a class, talk to your doctor about the Living with Diabetes program here at NKC Health. Jodie, I think we'll open it up to any questions, or if you have any questions, if anybody has any of that. But more than likely, I've been perfectly clear and coherent.
Yes. With a little humor. I like your humor,
Oh,
Jason. Yeah,
okay.
we can get
It's good to
along.
have at least one person that likes the humor.
Oh, I do. I like it. I was just trying not to laugh too loud at
Oh, that's
some
good.
of the
Yeah.
jokes. Yeah. But great information. And when you said shameless plug about how you don't need a referral for PT, not a
Yep.
shameless plug. I think that is a great thing. We do the Steady Your Stride event every year, and people really get a lot out of physical therapy. And it's great right now that you can see a physical therapist. And if there's more, direction that you need, then the PT does communicate with your doctor.
Yeah,
I think
that's
it's
right. Yeah.
wonderful. And then all the information that you shared about the Living with Diabetes class, when I sent out the link to this educational offering, I will also attach some information about that Living with
Perfect.
Diabetes program that we have here at NKC Health, because it's great and paid for through your insurance if you meet the criteria. So all of that is just very beneficial information, and I thank you for that. And thank you to everyone who was able to join. And if you weren't able to join and you did sign up, you're going to be getting a link to this offering via our YouTube channel, where there are multiple other offerings that live on there. And you could just go to town learning all about many different things. And also about the community classes that we offer here at NKC Health. Jason kind of touched on a few of them. We've got land exercises, we've got water exercises. They're just great options. And I will put a link to that too when I send you guys all this information.
Perfect. Thank you, Jody.
And then you guys can just absorb it and learn about it at your own convenience. And my contact information will be on that email. If you have any questions, feel free to reach out. And Jason, do you care if we share your contact information?
No, that would be great. Yeah.
Okay, we'll do it. All right. Well, thanks a lot again, everyone, for joining us today. And as I kind of alluded to, maybe we can get Jason in the future again to maybe talk to us about pain management. So we'll see. We'll see what the future holds, guys.
Happy to do so.
All right. Thanks, guys. Have a good day. Bye-bye.